Hi guys, welcome to the surgical instrument series. Here we'll discuss about each instrument, how you identify it and what its basic use is. So we'll start with the incision. Now in order to put incision, you need scalpel. In order to hold the blade, you need a handle, and this is what we call it as the BP handle or the ball Parker's handle. Now BP handle is a very basic instrument which is going to be the first instrument in your hand when you're going to put the incision. Now when you have the handle, you also need the knife as well. Now, in order to identify, this is your surgical blade. Now, when you take a surgical blade, you will notice that there's a number written on it, right? So each number has its own component. For example, if you talk about 22 number blade, that is for your laparotomy and the thoracotomy incisions. Then you have a smaller number like 11 number blade, which is going to be for stab incisions. For 12 number blade, it is precisely and specifically for suture removal. Now, once you take the blade, you will remove the blade, and this is how you will get the blade in your hand. Now, never touch the blade with the hand because it is sharp, it is unsafe, and it will become unsterile. So you can put it on a needle holder or you can put it on an artery forceps and then you load it. How do you load it? On a ball Parker handle, in a BP handle, you see there's a groove that is present. You will see in the surgical blade, there is a groove. Now, the angulation of both of them should match with each other, and then you take into the BP handle and then you gently load it. So you safely leave it on this component and then load it. This is how you load your blade. Now, how do you unremove it? How do you basically take out the blade from the BP handle? Again, a very important concept. Do not touch it. It's very sharp. It can cut through at any point. Just hold at the tip end, lift it up gently, and then just pull it off. This is how you remove the blade. Once you remove the blade, put it at a safer distance. This is your BP handle and the ball Parker's handle. That's the first thing that you should identify. So let's start with the very basic instrument, which is the first instrument that you will hold when you're going to give the incision. In order to give incision, you need blade, and in order to hold the blade, you need a blade holder. And this blade holder is what we call it as the BP handle. The BP handle is what we call it as the ball Parker's handle. Now this is a very basic instrument that you're going to hold it. You will hold it as if you're holding a pen, or you can hold it with the tip of the finger so that you can have a good control. Now, you have the BP handle. Now you need the surgical blade. Now the surgical blade, whenever you see, it will be in this sachet like this. There will be a number at the base of it. Here the number shows 15. You can have 22 size number, which is going to be for laparotomy or for thoracotomies. Bigger blade for bigger incision, smaller blade for smaller incision, like 11 number blade is for stab incision, 15 number blade is for precision incision, 12 number blade is specifically for suture removal. Now, you will take the blade out of this case and then you will load it onto an instrument. Now, here I have loaded on a needle holder. Never hold the blade in hand because it is sharp, it can cut through, it will cause problems, and also becomes unsterile. So load it onto another instrument, usually a curved artery forceps, which is an Adson forceps, or you can hold it on a needle holder. Now, always hold the blade on your dominant hand because you need a control, and the BP handle in a non-dominant arm. That is going to be, for me, it is my left hand. Now you see there is a groove in the BP handle and there's an angulation of the blade. Now these two should match. All that you have to do is load it on this and release it. Once you release it, hold it on top and just gently slide it. Once you slide it, it locks in, and this is how you load your BP handle. Now the scalpel is ready. All that you have to do is take it, mark it, and put the incision whichever way you want it. Now, every single time it is not fun only to load it, you need to unload it also. And if you don't do it properly, you might cause injury to yourself or to the person accompanying. How do you unload it? Again, get the same instrument which you used for loading it. Hold the blade at the base of it. Just lift it and gently pull it out. And this is how you safely unload the blade from the BP handle. And that's your first instrument for today. Now it's time to look at the forceps. The first forceps is this. Now it's a small forceps, you can see here, right? Now this is basically to hold it. There is tooth on the tip of it. You can see the tooth. The tooth is right here. This is to hold it. This is what we call it as the Adson's forceps. This is for, holding smaller tissues, more precise location, and especially onto the surface. If you're going into deeper one, you need a bigger forceps. And what is that bigger forceps? Let's look at the bigger forceps. Now, this forceps also looks like Adson's, but this is longer. And again, it has same tooth. The Adson's also has tooth. This also has tooth, but this is longer. Now this longer looking adsense is what we call it as the Gillies tissue holding forceps. So this is the Gillies tissue holding forceps and this is your adsense. What is the difference? Adsense is small, Gillies is longer. So common sense, for using the surface surgeries that is on the skin or the subcutaneous plane, I will use adsense. If I'm using in a deeper cavity, imagine I'm working in the abdomen, I want to hold the tissue deeper, I will be using your Gillies forceps. Now both of them, they have tooth, and when you hold the tissue, they are going to prick, punch and puncture the tissue, and especially if you're doing with the vessel, I don't want that to happen. So whenever you're working with the vessel, you need a special forceps, and that special forceps is this, an atraumatic de Bakey's forceps. You can see there is no tooth, it just snaps very well, holds it very well, and it is smooth throughout. This is what we call it as the de Bakey's atraumatic forceps. So all three of them is right in front of you if I just summarize it. Now, the first one was adsense, right? Now, the adsense elder brother was Gillies, and then you have de Bakey's, which is atraumatic. All three forceps right in front of you. Let's move on to next set of instruments. Now, the first one that you have, this is what we call it as the needle holder. Now, needle holder has the two fingers that is to hold. Now, again, a very common question that how do you hold it? The right way of holding it is one should have the thumb, the other should have your ring finger, right? And then the middle finger is going to act as your resting and the index finger is going to be your maneuvering finger, right? And you don't want to insert the entire thumb. If you insert the entire thumb, you will get locked. So it is only the tip of the thumb, then the ring finger, the middle finger forms the resting and the index finger forms the maneuvering component. Now this locking that you can see here, this locking is what we call as the ratchet. It is locked, and to unlock it, you just need to lift it up. Now, when you lift it up, it unlocks it. To lock it, just slide it, slide it, slide it, slide it. This is called as lock. And to unlock it, just put it up. Just gentle pressure and it unlocks it. This is the basic latch here, and this you can see a small tip. This is where you can hold the needle, and this is your needle holding tip, right? So this is your needle holder. The next one that we have is this. Now, this looks like a fancy instrument. The first half of the instrument looks like a needle holder, but then it changes here. What does it change? You can see there is this oval component, and this is what we call it as the sponge holding forceps. A very confusing question that they'll ask you, how do you differentiate from an ovum forceps? Now, in a sponge holding forceps, you have the ratchet. This is what we call as ratchet. The ratchet is present in a sponge holding forceps, but this is absent in ovum forceps. So you hold it. This can be also used. It's an atraumatic one. You can hold it for sponge holding. You can also use it to hold the tissue with the same component, right? So this is what we call it as the sponge holding forceps. The next one that you have is this. It's a curved structure. You can see it's a curved instrument, and this is what we call it as the adsense artery forceps, right? So this is also commonly called as artery forceps that you will see. Again, this will also have a ratchet. This will have a curved tip, and this it has got serration. So it holds the tissue well and it holds it stronger. This is your adsense curved artery forceps. The next one that you have, this is a meaty guy. Now, if I want to hold the tissue hard, especially if I'm talking about it, if I want to retract something well, for example, if I'm doing a thoracotomy and then I want a pleural peel to be held stronger, I will use this instrument. This is what we call it as coccus. Now, how do you know it is coccus? You see the tip, you see the tooth, you see how it is like it locks, it locks, it locks. It's like locking and locking, right? So this is what we call it as the, see these two, this is a single tooth, there is a groove that is present, it goes inside and it locks it. This is what we call it as the coccus forceps, right? So coccus is a workhorse for surgery to hold bigger tissues, hold them stronger, and it's a traumatic forceps, right? So this is your coccus forceps. Now, next one that you have, this is one of my personal favorite. This is what we call it as a mixture or a right angle forceps. So whenever I want to dissect, so if there's a tissue, imagine this is the finger and I have to dissect it under my finger. So this helps me to go and then dissect it like this. You can see I can bring it from these grooves and I can dissect it from the inner component. So to go behind any structure and dissect it, especially if this is, if imagine my little finger as a artery, right? I want to dissect this vessel. So I dissect it behind, under, I dissect it from here, and then I'm making the entire loop. So the right angle allows me to dissect from an underlying component, right? It allows me to dissect it from an underlying tissue, and it allows me to dissect it to the entire circumference. And this is a mixture or a right angle forceps. Now, I'm going to show you something really fancy. I don't know how many of you have seen this. This looks like a cobbler needle, but it is not a cobbler needle. This is what we call it as the Doyne's respirator. So what does Doyne's respirator do? Now imagine, usually we do it for our thoracic surgeries or whenever you're entering into thorax. If imagine there's a rib and that rib is adherent to the underlying structures or tissue, or let's say the intercostal muscles are fused, or I want to resect the rib, I'm going to hook the rib like this and then I am going to shear it off. So any underlying, see, imagine if there is anything which is an underlying attachment is there. To undo the underlying attachment, I'll go under the rib and I'll just literally shear this off. I'll literally shear this off and the rib will be freed. And this is what we call it as a Doyne's rib respirator. Now this is again a very fancy one. Everybody knows it. You're a seniorist. This instrument is what we use it for head and neck surgeries. This is what we call it as a mastoid self-retaining retractor. So you can see when I just lock it, this ratchet or serration that is present, it locks in a particular position and it keeps it in that particular way. When you want to unlock it, all that you have to do is just hold this and just leave it across it. So whenever you unlock it, just hold it at this particular position and this goes back, right? So when you want to apply it, just keep applying force, you'll get it. And when you don't want to unlock it, you just press this lever, right? So this is your mastoid's self-retaining retractor. Mastoid self-retaining retractor's advantage is, imagine that I want to spray this tissue out, right? So imagine there's a tissue of a groove I've created. I will just hold this and see. Now you can see it is holding by itself. I don't need to put any retractors, nothing. It just retains and holds the tissue in that position. And when I want to just undo this, I can simply go ahead and click it across, right? So if I have to just remove it, all that you have to do is hold this and it goes by itself, right? So this is how you unlock your mastoid's retractor as well. The next one that you have is a quite interesting one, right? Have you ever seen this instrument? Now this is where if you have done a thoracic surgery and if you have split the ribs and you want to approximate the rib, this is what we call it as the Bailey's rib approximator. So this is how you can see the entire approximator is there. Imagine there are two ribs which are present and they're so far apart, right? So I want these two ribs. These two ribs are too far apart. I want to bring them closer. So what I'll do is I will apply this Bailey's rib approximator. I will apply the Bailey's rib approximator. These are the two fingers. I want to bring they're part. Imagine they're far apart as ribs. I want to bring them to closer. So gently I'm going to apply this retractor. And you can see as I rotate, you see my fingers are coming closer. My fingers are coming closer and this is what we call it as. Now the rib is approximated. I can tie, I can suture, I can I can hold them together and this is what we call it as Bailey's rib approximator. Now, this is also a fancy retractor that you can see. On one hand, you have a right angle, other side you have these fangs. And this is what we call it as Zerny's retractor. It is spelled with a C, but C is silent. It is called as Zerny and it's called as Zerny's retractor. So one end you can hold it this way, another one if you want to retract it, especially want to lift something up, this helps it quite effectively. This is your Zerny's retractor. Now, this is something which is you will see in ortho, you will see in general surgery also, in your thoracic surgery also. This is what we call it as a bone cutter, right? So you hold the bone in between. I don't want to press it because it will cut through my finger and just snap it. So when you snap it, this is an angulation that you will always get it. So you angulate the bone. If the bone is here, you go inside, you angulate it so that you cut approximately in the straight line. And this is what we call it as the bone cutter. This is again, in fact, this is considered to be as the holy spectrum or the holy, I would say, instrument of your thoracic surgery. And this is what we call it as a Fino-Shito. It's a very fancy word. It's a Fino-Shito. It is a Fino-Shito retractor or also called as the rib shear retractor. So you put it between the chest wall and you keep opening it. It's a self-retaining retractor and then it holds it in position. I want to operate it, I'll operate. And then when I want to close it back, I just need to rotate it this way. This is called as the Fino-Shito. You can see these openings are present. This is your Fino-Shito rib shear retractor. And that's it for the first series of your retractors as well as instruments.